This is a quick review of a patient with Parkinson's disease. Risk factors for Parkinson's disease includes age. Young adults rarely experience Parkinson's disease. It normally begins in middle or late life, and the risk continues to increase with age. Heredity. Having a close relative with Parkinson increases the chances by about 4 to 6%. Sex. Men are more likely to develop Parkinson's disease than women. Exposure to toxins. Ongoing exposure to herbicides and pesticides puts a person at slightly increase of Parkinson's. Some of these toxins inhibit dopamine production and promote free radical damage. Those involved in farming are more exposed to toxins and have a greater prevalence of Parkinson's symptoms. A tremor with Parkinson's can be so minimal initially that only the patient may notice it, more prominent at rest, and is aggravated by emotional stress or increased concentration. It is described as pill rolling because the thumb and the forefinger appear to move in a rotary fashion. Bradykinesia is difficulty in starting, continuing, or coordinating movements and is one of the most common crippling symptoms. Rigid muscle. All striated muscles are affected, including those that involve chewing, swallowing, and speaking. The patient may first notice this sign when they are no longer able to swing their arms when they are walking. Posture and balance. Problems secondary to bradykinesia can be alleviated by consciously thinking about stepping over a line on the floor, lifting their toes when stepping, 1 step back and 2 steps forward, getting out of a chair by using arms and placing the back legs on small blocks, removing rugs and excess furniture. Simplify clothing from button, maybe go to Velcro, having elevated toilet seats. The loss of autonomic movement is shown by decreased blinking, swinging of arms while walking, swallowing of saliva, self-expression, and facial movements. Now, dementia. This is a later stage of Parkinson's. Alzheimer's medications have been shown to help. Complications. Depression is common in Parkinson's patients and is usually handled with antidepressants. Receiving treatment for depression can make it easier to handle the other challenges of Parkinson's. These patients experience changes in facial expressions or a mask-like face with wide open fixed staring eyes, and this can be caused by rigidity of the facial muscles. Another complication could be ocular gyrocrisis, in which the eyes become fixed with a lateral and upward gaze. It kind of catches you off guard because it looks like the patient is literally rolling their eyes in the back of their head. The rigidity can lead to difficulties in chewing and swallowing, particularly if the pharyngeal muscles are involved, and as a result, this may result in inadequate nutrition. Uncontrolled drooling might occur, and in addition to changes to voluntary movement, many patients experience autonomic system symptom changes such as excessive perspiration and orthostatic hypotension. Evidence now shows that orthostatic hypotension is related to baroflex and loss of sympathetic innervation. And as you can guess, this can lead to falls and injuries. The patients do experience sleeping problems and often have trouble falling asleep and may frequently wake up during the night. They may also experience sudden sleep onset called sleep attacks during the day. The muscles they use to chew and swallow may be affected in the later stages of the disease, which makes eating more difficult. Parkinson's disease can cause either urinary incontinence or urinary retention. Because many people with Parkinson's develop constipation, and this is because the digestive tract works more slowly. Constipation might also be a side effect of medications used to treat the disease. And sexual dysfunction. Some people with Parkinson's may notice a decrease in sexual desire, and this may stem from the combination of psychological and physical factors, or it may be a result of physical factors alone. Treatment can include deep brain stimulation, and this is used when medications are no longer effective in controlling the patient's symptoms. A thin electrode is implanted in the thalamus or subthalamus and then connected to a pacemaker that delivers electrical current to interfere with tremor cells. The electrodes are connected to an implantable pulse generator that is placed underneath the skin in the patient's chest, which is similar to a cardiac pacemaker. The patient uses a magnet placed over the implantable pulse generator to adjust the settings and to check the battery status. Ablative stereotactic pallidotomy. This uses a stereotactic head frame and the patient is placed on IV sedation. A burr hole is made in the cranium. An electrode or cylindric rod is inserted into the target area. The target area receives a mild electrical stimulation and the patient reaction is assessed for reduction of tremor and rigidity. If there are no results, then the probe is repositioned. An alternative to stereotactic pallotomy is thallotomy. This procedure is effective for a limited number of patients. Because bilateral procedures have increased surgical complication rates, only unilateral surgery is done to benefit the side of the body that is most affected by the disease. A related procedure, cryothallotomy, uses a supercooled probe that is inserted into the thalamus to freeze and destroy areas that produce tremors. In transplantation or restorative surgery, dopamine-producing cells are implanted into the striatum. The cells used for transplantation may come from one of several sources: the patient's body, human embryos, and pig embryos. The patient needs to eat a nutritionally balanced diet that contains plenty of fruits, vegetables, and whole grains. These foods are high in fiber, which is important for helping prevent the constipation that is common in Parkinson's disease. Food should be cut into bite-sized pieces. Several small meals to prevent fatigue, and usually a soft diet or thick cold fluids like milkshakes are more easily tolerated. Food intake is recorded daily or as needed. The patient may experience weight loss as a result of altered food intake and increased number of calories burned secondary to muscle rigidity. The patient should be weighed once a week and adjustment made to diet as indicated. As the disease progresses and swallowing becomes more of a problem, supplemental feedings become the main source of nutrition to maintain weight. Nursing management. Communication is facilitated if the patient takes deep breaths before speaking and uses diaphragmatic speech. The patient may suffer from slurred speech. So a telephone receiver which amplifies a patient's voice is also available, since they may suffer from volume reduction, also known as hypophonia. Instruct the patient to speak slowly and clearly and to pause and take deep breaths at appropriate intervals. Advise the patient to organize thoughts before speaking and encourage the patient to use facial expression and gestures, if possible, to assist with communication. If possible, other alternative methods will be suggested, like a communication board, mechanical voice synthesizer, or computer. Maintaining functioning. A patient's response in the early stages of the disease process often are anxiety, depression, or panic, and patients are taught how to initiate raising from a chair by placing the hands on the arms of the chair and pushing up. Constipation is due to a decline in motility, reduced fluid intake, medication side effects, and it is addressed by increasing the patient's fiber and fluid intake and by increasing the patient's mobility. Patient mobility is increased when the patient is taught purposeful activities and to concentrate on the way that they walk. Urinary. The bladder concerns are with urgency, frequency, incontinence, infection. With infection is increased confusion and fatigue, which then promotes another vicious cycle. A decline in swallowing. Drooling, choking, they're clearing their throat frequently. They'll have reduced intake, weight loss, heartburn due to a decline in motility, problems with nausea and vomiting, pain, bloating, and fullness with small amounts of food. Discharge to home, it's important to review the drugs and the drug-food interactions. As the disease progresses, it's important that they understand dosage schedules. Adapting to home, physical therapy can help strengthen and tone underused muscles and give rigid muscles a better range of motion. The goal is to help the body build strength, improve balance, overcome gait problems, and improve speaking and swallowing. Instruct the patient to not move too quickly. Aim for the heel to strike the floor first when walking. If they notice they are shuffling, tell them to stop, check their posture, because it is best to stand up straight. Dressing can be the most frustrating of all activities for someone with Parkinson's. The loss of fine motor control makes it hard to button and zip clothes and even step into a pair of pants. An occupational therapist can point out techniques that make daily activities easier. Instruct them to allow plenty of time so they don't feel rushed. Have the clothes nearby, and choose clothes that can slip on easily, like sweatpants, simple dresses, or pants with elastic waistbands. Fabric fasteners like Velcro instead of buttons. Gait training and exercise is simple physical activities such as walking, gardening, and swimming can improve their sense of well-being. Gentle smoothing massage techniques may help provide relief from muscle rigidity and may have some neuromuscular benefits as well. The slow flowing movements of Tai Chi help maintain flexibility balance, and relaxation. Also, the benefits of massage have been recognized by people with Parkinson's because it does ease joint and muscle stiffness caused by the symptoms. In the later stages of the disease, they may fall more easily and thrown off balance by just a small push or bump. So the instructions would include: don't pivot your body over your feet while turning. Instead, make a U-turn. Don't lean or reach, and keep the center of gravity over the feet, and try not to carry things while walking. As Parkinson's disease is a progressive illness, at some point decisions must be made when the oral route of administration is unreliable, whether it's a PEG tube, hospice, do not resuscitate, hospitalization, and other end-of-life considerations.